Hello everyone, my name is Sayed and today I'm going to present my clinical pearl presentation. The topic of my presentation is Terlipressin injection. The background of this drug is that the hepatorenal syndrome is an acute and serious complication in patients with advanced liver cirrhosis, and it is associated with rapidly progressing renal failure. Hepatorenal syndrome is a major cause of death before liver transplantation in patients with advanced liver cirrhosis. Currently, there is no approved treatment in North America for hepatorenal syndrome. Terlipressin is still an investigational drug in the United States as safety and efficacy is not approved by FDA. Pharmacology: Terlipressin is a prodrug that needs to be converted to its biologically active form, lysine vasopressin, that reached to peak concentration after 60 to 120 minutes of the administration of the IV bolus injection. Terlipressin exerts its effects through V1 and V2 vasopressin receptors. The mechanism of action: Terlipressin helps improve arterial blood pressure and systemic vascular resistance, and at the same time reduce cardiac output, heart rate, and portal venous pressure flow. This in turn deactivates systemic vasoconstrictor system, resulting in improved renal function and excretion of sodium. Terlipressin is indicated for hepatorenal syndrome and bleeding esophageal varices. The dose: it is provided in the loading dose of 2 to 4 milligrams IV, followed by 1 milligram every 4 to 6 hours for 2 to 3 days. The most common adverse effects with the use of terlipressin are headache, transient abdominal cramps, ventricular and supraventricular arrhythmia, and bradycardia. That leads to the warning of this drug. Several cases of QT prolongation and ventricular arrhythmias, even in some cases torsades de pointes, were reported with the use of terlipressin. Extreme precautions should be taken when administering terlipressin in patients predisposed to arrhythmias. Terlipressin can potentiate the hypotensive effects of certain drugs such as beta blockers. Terlipressin can also induce severe bradycardia with the use of propofol. Terlipressin is available in 1 milligram powder form that needs to be reconstituted with normal saline solution 5 ml. Moving towards the evidence for the use of terlipressin. In one study, terlipressin and albumin were compared with albumin-only treatment for patients with hepatorenal syndrome. This was a randomized controlled trial comprised of only 46 patients. 23 patients were randomized in terlipressin and albumin group and 23 patients in the albumin group. 10 patients in terlipressin group and only 2 patients in albumin group showed improvement in renal function at the end of the trial, and it was statistically significant. In another trial, terlipressin versus placebo were compared for the treatment of hepatorenal syndrome. In this trial, 56 individuals were randomized into 2 groups. Group 1 received terlipressin plus albumin, and Group 2 received placebo plus albumin. The primary endpoint was the serum creatinine less than or equals to 1.5 milligram per deciliter. Twice as many patients with terlipressin reached the primary endpoint as compared to the placebo, and it was statistically significant. Last but not the least, there is a study going on which is known as the confirmed trial, which is a phase 3 trial in which terlipressin is compared with placebo. This trial is comprised of 300 patients with hepatorenal syndrome, and it is currently going on in United States and Canada. It is one of the largest multi-center randomized controlled trial in hepatorenal syndrome. Now, the result of this study is yet to be released. However, it is believed that the study will pave the path of terlipressin for the approval by FDA. Thank you so much and have a good day.